An unexpected treatment is emerging for polycystic ovarian syndrome, or PCOS. You know, September is actually PCOS Awareness Month, and GLP-1s like Ozempic, Wegovy, and Mounjaro are becoming a popular option to manage that condition. OBGYN Dr. Elliot Groff with Women's Health Domain at St. David's Women's Center joins us now to give us more perspective on how GLP-1s are being used to treat PCOS. Thanks so much for being here today.
Well, thanks for having me.
We're learning so much about these GLP-1s. Let's talk about what PCOS is. Tell us about the condition and kind of what that entails.
Yeah, so PCOS stands for polycystic ovarian syndrome. So what that is usually, these women will come in saying, well, I'm noticing a lack of normal cycles, not having a regular period. They might have polycystic ovaries. They might have weight gain or difficulty with weight loss, sometimes infertility. And then even more concerning than that, over a long enough time scale, there's increased risk of uterine cancer, high blood pressure, high cholesterol, diabetes. So it's really attached to kind of everything. We say polycystic ovaries, but it's really the whole body that's affected.
GLP-1s we know originally approved for diabetes, later for weight loss. We've seen them gain in popularity. So how is that medication specifically breaking into the PCOS treatment?
Yeah. Ultimately, PCOS, we have too many androgens relative to progesterone, usually with some degree of insulin resistance. So what we're doing with these weight loss medications is we're decreasing the amount of insulin we need by lowering this resistance. And that ultimately is going to kind of break that cycle of the inappropriate hormones. So weight loss does that on its own, can decrease resistance, and then these medications kind of are the next step in helping that along.
How do GLP-1 drugs interact with a woman's menstrual cycle?
Yeah, it's variable, of course. When we're talking about PCOS specifically, these are women who usually aren't having regular cycles. So what we can do is by causing this weight loss, sometimes we can actually get a regular cycle to happen. In those who do have regular cycles that are very heavy oftentimes, we're actually noticing the cycles are becoming a little bit more normal, a little bit less heavy flow and less problematic just from a day-to-day standpoint.
What are some benefits patients are seeing as a result of GLP-1 treatment? We were talking off camera about, it seems like there's a study coming out frequently about GLP-1s. What are some of the benefits patients are seeing?
Yeah, I mean, the one everybody thinks about is weight loss, right? That's one of the big ones. But, on top of that, we're noticing decrease in diabetes or high blood pressure, cholesterol. And, a big one, I had a patient who recently saw me, who I saw just for her annual exam. She'd let me know how weight had been a problem. So, it was weight, it was, I really would like to get pregnant, and it just seems like it's not happening. So she gets on these meds, and then, I saw her recently, and she's expecting.
Wow.
So, I mean, it's making a big difference, and, you can't say that'd be everybody, but I think in some of these patients, it's huge.
It's making huge differences.
Yeah.
GLP-1s aren't an FDA-approved treatment specifically for PCOS. What would it take to get that approval, and how can patients seek it out otherwise?
Yeah, I think that's about a point. So, for those who are taking it for PCOS, it's strictly off-label use at the moment. So it's not FDA approved. Ultimately what that usually means is patients are having to work with their doctors and kind of figure out the most cost-effective way of getting this done. But I think ultimately as more data comes out, more studies come out showing the potential benefits and improvement just in day-to-day life, I suspect that approval might be something that happens. That's my hope, at least.
I hope so, too. It's really interesting to watch these studies as they're released and all the benefits that they're seeing from GLP-1.
Yeah, absolutely.
Thanks so much for your time, Doctor. Great to have you.
Thanks for having me. I appreciate it. Thank you.